drugs are used for many different reasons and are prescribed every single day. Even somebody close to you may be prescribed antipsychotic drugs such as haloperidol, and you may not even know. Haloperidol can fully reconstruct the way your body produces and uses hormones such as dopamine. These hormones are your happy hormones, basically, and control your moods when you're happy or sad. Haloperidol is one of the most effective antipsychotic drugs that can be used to treat a psychosis state. The way that haloperidol works is very confusing and not very known at this point. We know how it is used and then what the effects are, but the exact sequence of how it's actually working is unknown at this point. But the things we do know about it is that it attacks our D2 receptors in our body, which control the way our hormones are all produced and using. So like if you have psychosis thoughts, you have less dopamine. So when you take the medication, your body produces more to make you happier and have less psychotic thoughts. In the article, Haloperidol for Delirium in Critically Ill Patients, Protocol for Systematic Review, states that haloperidol works on every single level of our central nervous system. It controls our movements, our thoughts, our speech, our hearing, and pretty much all the things that your body does on a daily basis. So, when do we use this medication? Doctors mainly use this medication for patients that have schizophrenia or Tourette's, or even children with really bad behavioral issues. And the way that this medicine actually helps them is that it controls their movements in their bodies. So if you have schizophrenia or Tourette's or behavioral issues, you do things with your body that you can't really control. So when you're taking the medication, it helps to mellow it all out and help you to function normally. In the article, Haloperidol versus second generation antipsychotics and long-term treatment of schizophrenia, states that haloperidol can be used in schizophrenia, Tourette's, serious behavioral issues in kids, and it also states that we should not use this medication when our patients will present with Parkinson's disease, if they have central nervous system depression, which I know that sounds like a mental issue, but it's not. It's like if your central nervous system in your body is under attack and you can't, your physical state is not fully good. And if your patients are elderly and have dementia with Lewy bodies. And these can cause very, very serious issues. So we try to avoid prescribing any patients this medication when they present with those symptoms as well. And for dosages, when we are giving our patients this medication, there are many different ways that we can administer it. We can give it in pill form, we can give it in an intramuscular injection, or they can have it in liquid form for liquid injections and orally. And this is basically for many different reasons. In an example, if you have a child who has schizophrenia or Tourette's, sometimes they won't want to take their medication regularly, or it'd be really hard to force this child to take their medication every single day. So we can put an intramuscular injection into their arm, and it'll last up to 3 to 4 weeks. So it's a very good option for children or anyone with schizophrenia. And the regular common dosage is 0.5 to 5 milligrams at least 2 to 3 times a day, but the maximum is 30 milligrams per day. And risk and side effects. This is, as any medication does, there's many risk and side effects, as we all know, but some of the side effects for this medication can be very severe and have very long-term lasting effects. Some of the regular side effects that may occur could be vomiting, insomnia, mood changes, or skin rash or spinning sensations. In the article, Use of Haloperidol in Psychiatry, it states that some of the most common side effects of this medication that can be easily controlled, or dizziness, muscle fatigue, tremors, or seizures. And some of the even more risky side effects that are not very common but can happen are death in elderly patients, renal failure, irregular heart rhythms, or hallucinations. So if you present with any of these signs, you should immediately stop taking the medication because it could be very serious. So basically, this medication can help hundreds of millions of people every single day, although it can have very serious side effects, just as every medication does. But this medication helps a lot of people every single day.